Okay, and here we are with another episode of The Art of Mindful Medicine. And of course, I'm Dr. Seth Gilson, holistic dentist, certified yoga teacher, and speaker. And today I have a very special guest, someone that I've been following and in contact with for quite a while now, Dr. Mark Burhenne. And he is a best-selling author and a family and sleep medicine dentist who was in private practice nearly 35 years. He focuses on patient-centered functional dental healthcare. He received his degree from the Goodall School of Dentistry in San Francisco and is a member of the American Academy of Dental Sleep Medicine. He is a TEDx speaker, and his advice regularly appears on media outlets such as CNN, NPR, The Huffington Post, Men's Health, and CBS. He is the creator of AskTheDentist.com and is known as Dr. B to his followers around the web and on his podcast. His company is dedicated to exploring the mouth-body connection and the primary role of the oral microbiome and what it has, not just with oral health, but how it impacts systemic health as well. Dr. B's mission by becoming a healthcare influencer has been to illustrate to patients as well as providers that optimal health can only be achieved by addressing one's own oral health. So again, Dr. B, thank you so much for coming on here with me today. And as always, with the Art of Mindful Medicine, I'd like to start with gratitude. So could you please share with us 3 things that you're grateful for today?
Absolutely. And Seth, please call me Mark. Gratitude. Whoa. I usually leave that for the end of the day. Although it's a good morning routine to think of gratitude. I'm thankful for many things. I mean, more than 3. But what comes to mind is what we're doing today. I have a voice, I have some influence. And I'm very passionate about what I'm doing and what you're doing, essentially, and dentistry. And it's just nice to be able to influence and be part of that discussion and teaching and educating and informing patients, followers, other healthcare practitioners, government organizations. That was a recent development. That was fun. And also corporations. And whoever else is listening or wants to listen. And so that I'm very grateful for that. And I do not take that lightly. I'm grateful also for my own health and for my family's health. Again, it's their challenges, but we've always been able to get through them. And we're very focused on health and mindfulness. I just got back from a retreat with James and Esther in Costa Rica, kind of tuned that up a little bit, breathing especially. So, I'm not in perfect health, but I'm probably in the top 1%. I have good numbers. I know a lot about health. And again, it's a real challenge and a lot of sacrifice, but I'm happy. In other words, I'm very happy that I feel as I do and feel good and speak and, talk about things pretty coherently. And I mean, that's, at age 64, that's, I think, a gift. And you have to work hard for it. I would tell everyone that work hard for it. And it's totally worth it. I know a lot of my friends are beginning to fail in one way or another, and it's very sad to see. And I've known them for 30, 40, some family members, 60 years. And you can go back in time and pretty much, point out reasons of what lifestyle choices, some of it's genes that were there that caused that to happen. So I'm just glad from an early age I was able to make the right choices. At least I had that drive. Where that came from, I don't know. We can talk about that later if you want. Probably my mom and my dad, but very thankful for my own health and the ability to go out and enjoy life and have meaningful moments. Kind of holding a moment. I mean, that's really, you can't take that for granted. It's a skill. You have to kind of learn how to do it. And, it took me a while to get there. And then what else? Gosh, I'm just thinking of what pops in my mind. I'm really very content with my married life and family and where I live here in Napa Valley. And just having a wonderful environment to work in. I'm just looking at my barn and it's just, you have to appreciate comfort and safety and security. You can't not include that in in your gratitude. And I have a lot of that. I've got beautiful outdoors, and the FedEx guy is friendly. I mean, it's just like you could go on and on. So I'm very, I don't want to sound too corny.
No, that's great.
Yeah,
I
right.
totally agree. I mean,
Yeah,
we're extremely fortunate just being in the United States, first of all.
yeah,
So,
totally.
and to me, like you said, your second one, health, and people have said this for I don't know how many years, but health is the true wealth, right?
Hmm.
Because without that, we can't do anything else.
Yeah,
We can't be of
yeah,
service to others. We can't be of service to our family. We can't be present when
right,
we're not healthy. So,
right.
and that's ultimately what and why I'm motivated to do this. And it was kind of sounded similar to you that it started at a very young age for me. My driving force was soccer, but it really propelled me into a health and wellness lifestyle that at that point I would have never known that where or how it would get me to this place. So
Right.
thank you for that. And I would like you to share with some people. I don't know how many people know your story, like maybe where you're from and a little bit of your personal background when you're
Yeah.
young.
So I grew up in San Francisco. Again, I said earlier, I'm 64 years old. So I was born in 50s, late 50s. San Francisco back then was a very interesting city. I had free roam of the city on my bicycle. I would bike through all sorts of neighborhoods. Haight-Ashbury was a very interesting. I was literally 10 years old when the likes of Carlos Santana and Jefferson Starship were playing pre-first album in Golden Gate Park. And the only reason I was going there is because that's where all the bike stores were and still are in the city. And I was buying parts because I had a little side hustle fixing bikes for an hourly wage. A lot of my friends couldn't tune their French derailleurs and all of that. And so, but we would bike the city. I mean, the only places we stayed away from were like the Mission, which ironically now some of my daughters live in, and it's gentrified. And so, I just went to a great school. I was a hymnal boy in a big cathedral in San Francisco. A lot of people don't know that. I used to sing in a choir every morning at 9 o'clock. I used to put my purple robe on and then make sure all the hymnals were in place. I was influenced early with music with my dad and mom, but in that cathedral, which is a replica of a true, very large late Gothic cathedral, it has one of the largest organs I think, on the West Coast. It's called the Alexander Hamilton organ, I think. And our organist was very well known, John Fenstermaker. I don't know if he's still around. And so he would play, fugues like from Bach at full bore, and there were pipes at the end of the apse and above the center of the church and right next to us in the choir. So that was very inspirational, and was very athletic, played a lot of sports. We talked about this earlier, soccer and baseball, and the city was a great place back then. It was pretty safe, and it was my dad was a physician there. My mom was into holistic medicine. I could hear them argue at the dinner table about the conflicts there. And that was while I was eating my dad's, he was German, sauerbraten, which is a kind of a fermented piece of meat, which was great. In hindsight, glad I had that, was raised that way. But then my mom would add like dandelion stems to the salad, and we were all like, what is that? So definitely some early influences there. By age 17, late high school, I was a total health nerd in terms of longevity, supplements. I mean, what 17-year-old in college, in high school, does that, right? I mean, I would play paddle and skip school and soccer, skiing. I loved skiing. My dad was a great skier, so we skied every weekend. But that's kind of where I started. And was it those arguments at the dinner table between my dad and mom? I don't know. But that's how I got interested in healthcare. And so I read all these books. I mean, I was reading books about sustainable farming, biodynamic stuff. There was Berkeley was across the bay. There was a lot of influence there. There was a famous author there. His name was Friedhof Capra. He wrote The Turning Point. which is a big, thick book. I reread it every 10 years just to see where we are, and we didn't make it. We're not what his vision was or where we should be in terms of the environment and big food, healthy food sources and availability. And then I went to college, and then in Canada, University of British Columbia. Did not go into pre-dental at that point in time. I was a history of art major. And ironically, I was studying Gothic architecture. I wrote a thesis on comparing Chartres to Bourges. Those are two big cathedrals in Europe, in France. And my argument was that Chartres should not be the prototypical building for Gothic architecture. It should have been Bourges, which is further south of France. And I was just deep into that, enjoying myself. And then one day I went down into a basement, and this is pre, computers as we know it. It was an old CPM machine with 8 big 7-inch floppies. And I took a personality test that was tied to, advice on, what to do in life and career advice. And number 2 was dentistry. And it came out of left field. My dad was a well-known physician, so I had said, there's no way I'm doing that. Not following in his footsteps. Didn't really like medicine at that point. Didn't make sense to me. I think it's gotten worse now, of course. We can talk about that if you want. But back then, even I just didn't like what he was bringing home. And he was a radiologist. So diagnostics, very important. But then, they were just treating symptoms back then as well. And then I had to catch up. And so I took an extra year in college, took my pre-dental, went back to my first choice in San Francisco's dental school. And that's kind of where I ended up. Just after 36 years of practicing, I'm now an influencer using the internet. I mean, it's mind blowing. I had no idea.
The internet got you into dentistry, basically. I mean, the computer.
But it was not connected to the web.
Whatever that system computer, was.
Yes.
A computer, yes, a computer.
Exactly.
And now you use computers to actually give share the knowledge and experiences you've had with the world, essentially.
Right. And ironic, I'm giving a lot of career advice to a lot of young people and a lot of young dentists. So it's funny how things go. But I was very fortunate, had a great childhood, good parents, and made some good choices, made some bad choices, and despite that, I'm still here. So it's good. Yeah.
So on that front, in your earlier years, is there an event or an experience which impacted and molded you into who you are today?
Boy, that is a great question. Probably the death of my mom and dad. They died early. Alzheimer's, dad with dementia. Sorry, dad was ALS with dementia, which is a rare combo. Mm-hmm. And he died at almost 70, almost made it to 70, which is young for a very healthy, energetic, fit man. I mean, he was mountaineering and skiing and traveling the world and working and publishing and doing research right up until probably age 66. And then my mom, who was that health nut that we discussed earlier and was pretty healthy. Later in life, I realized there was a lot of, in both of them, undiagnosed sleep apnea, probably some metabolic stuff. They weren't big drinkers, casual smokers back in the 60s at cocktail parties only. And she died. I mean, she was pretty much gone, full on Alzheimer's by, I want to say 65. Early menopause, perio, I mean, all those connections to Alzheimer's, P. gingivalis bug, and sleep apnea. And, who knows what they were exposed to, because they did travel a lot. They were, because my dad was a physician, he traveled behind the Iron Curtain to teach. There are a lot of, he was in post-World War II Germany as a young man, a lot of toxins, who knows? But I think that really, it wasn't like a sudden moment where, oh my God, my parents died. I think maybe over a period of 5 to 10 years, you kind of think of, legacy. What do you leave behind? What kind of parent am I going to be? And what's important to you? And then you also think about how many years you have left. I have one good family member, my grandmother, Clara, Dickus, or Clara Burhenne, that was her maiden name. She was a PhD, cigar smoking German grandmother, my Großmutti, and lived in Bavaria. Was a single mom, raised her two boys, one being my dad, and she died when she was 99, and she was clear-headed to the end. And she had a broken hip at like age 91, was lying in her wine cellar for 3 days before they found her. She was just breaking open bottles of wine to survive. I mean, just an amazing tour de force. And so I'm hoping I got some of her genes, and and not that drinking all that wine is good for you. Anyway, so I would say probably that. I mean, there are many other moments, certainly, but I think moments that affect you and make you think about things tend to be on the traumatic side. And I think caring for them and seeing that degradation in life, in quality of life, and losing your memory and your memories, and your body just wasting away, I think that definitely should have an impact on you, but it certainly had an impact on me.
Yeah, I can definitely see how and why. I mean, obviously, parents are two of the closest people to us, and the fact that now how much you share, which we're going to get into in a little bit, about Alzheimer's, and we were talking about the oral health and oral microbiome, and the different bugs in the mouth and how it affects systemic health, especially with sleep and sleep apnea, because like you I'm going to have you talk a little bit about later, that it really impacts our overall health metabolically and just everything about us. So thank you for that. And currently, what's an area in your life that you're actively working to improve?
I would say my weight and my muscle tone. That's about it. That's what I would like to do. And so just recently purchased a tonal unit, getting out more on my mountain bike, and doing more floor exercises, more core. I think it's pretty obvious now to any healthcare practitioner, should be, that muscle mass is what leaves you as you get older. But if you can keep all of it, or increase it even, I think as you get older, I could have more muscle mass than I did when I was a scrawny kid back in high school. At least that's the hope. I think that would be that's my number one goal right now. So just squaring that life curve and keeping my life quality as level as possible, because as I get older, we know where it's going, but you do have control over that trajectory. And so I'm very lucky. I don't have any chronic diseases. I'm not on any meds. My oral microbiome tests are stellar. We can talk about that later if you want. So that's kind of, I try and keep it simple and just focus on things that I know if I focus on one or two big things, then that will have big impacts later. And then if I can correct that, then on to the next thing, whatever that may be. But boy, if we can, metabolic health, right? That is one of the big factors in anyone's life, whether it's relationships or success at work, or staying out of the hospital, staying healthy, oral health, you name it, and living longer, and your ability to do things. It's all based on lifestyle. So that is something that we need to keep at. It's an ongoing, I don't want to use the word struggle. It's an ongoing kind of activity that you really have to focus on.
Yeah, the word that came to mind to me is practice. It's a long-term practice, because we're always learning and improving, and sometimes we're not on our A game, but you give 100% of whatever you can give that day. And I completely agree with you. Sarcopenia, I suggest people go and look up what that is. And over the past year, I've been an athlete and pretty much exercised my whole life, thankfully. But sarcopenia is one of the biggest predictors of longevity.
Yes.
So that's a huge factor that I suggest people look into, and I'm happy that's what you're working on. That's a great thing. So you mentioned this a little bit earlier, and of course, being that we're on the art of mindful medicine, I'd like to talk to you a little bit about mindfulness. And can you just express what that term means to you?
Mindfulness. So another functional dentist and we just came out with we're coming out with a 6-hour resetting your oral microbiome course. And one of the modules is mindfulness. And the other dentist, Dr. Stacy Whitman, was the one that presented that module. We took turns presenting different modules. So I was able to sit back and listen. And so I learned a little bit. The term's kind of vague, and it has a very broad definition or scope of what it means to people. And that's okay. I mean, as long as they get close to what I'm about to describe, I think mindfulness is a human trait that is innate in all of us. It doesn't mean it always comes out, but it's there, and we all have the potential for it. And it's really being aware of our surroundings and in a comprehensive way, in seeing things in the right way. A lot of us are in denial. I can use many examples. Typically health, but you could talk about, what their version of a historical event is, and they deny the facts, and then there's political denial. But healthcare denial is a very common thing. You see it all the time with your patients, especially with male patients, right?
Yeah.
But it's like, do you snore at night? No, I don't snore. I've never snored in my life. And then you talk to their partner, their wife, or their partner, and it's like, oh my God, like I literally have to roll them over, and it goes on all night long. And so that kind of stuff. So mindfulness to me is, and this is going to sound corny, but my definition of being a man is compassion and teaching and getting the message out, supporting people, supporting my family, start there, supporting the kids, the grandkids, and then supporting other people, supporting practitioners, supporting all my listeners, giving them information. I call that the Boy Scout kind of mentality. So when I'm out on the ski slopes and I meet someone, or I'm with a friend, the first thing I want to do is show them all the little hidden secrets on the mountain. And that's just and to me, that's being not a leader. It's more being a good person. Being aware of your fiduciary duty as a professional. That would be one small example. And being supportive and being kind to others, and then also being kind to yourself. But it's more about awareness, and being honest with yourself, and realizing when you don't, that inner dialogue is you're lying to yourself. And then turning that around, and then of course that makes you a better person to the people around you. So I don't know if that's your definition, but mindfulness is really something that we all have in us, but there are several external influencers. It could be TikTok, it could be a food choice you're making that you're addicted to, and you're just telling yourself it's not that bad, when in reality it's spiking your blood sugar levels. I mean, it could be on so many different fronts. So it's just making sure and being honest with yourself that you're seeing the world and your environment around you, and then being compassionate to others and helpful, and being a good person, not being a drag on the people around you or on society in general.
Mm-hmm. Yeah, no, thank you for that. That's why I asked the question, because I like hearing different people's perspectives on the same thing. But at the end of the day, yes, it's about awareness.
So I'm curious, in a nutshell, what is your definition of mindfulness?
It's hard. I can't say that I've fully formulated my own definition yet at this point, just because, like you just experienced, it's not something to just simply define. It's a state. Or like you said, it's a trait. To me, it's a state of being, and it's in a way of experiencing life. So it's more of an experience rather than an action. You can mindfully do things, but it's really that, well, like you said, an inner dialogue. But for me, it's more like an inner state, and that presence and that awareness of what's within and what's without at any given moment is how I feel about mindfulness, essentially.
Yeah. I think in a nutshell, does the real you show up every day?
Yeah, authenticity is definitely part of it, for sure.
And
And that's great that you're doing that course with Dr. Stacy. She's been on here too. So for you guys that
Yeah,
may not have seen it, go and watch that episode. Dr. Stacy is awesome.
she is.
She's we talked about the functional medicine course and things like that. So
Good.
it's great, and I love her content as well. She's a good person. So
She's amazing.
really happy to hear you guys are
Absolutely.
doing
Yeah.
that.
Yeah.
So are there any specific practices that you have for mindfulness in your own life? And if so, how have these maybe guided or impacted your life?
I think breathing and learning how to, you know, calm the inner dialogue and anxiety and worrisome thoughts. Um, you know, I don't meditate. I was kind of had my own breathing methods before I was exposed to like Wim Hof and yoga and all the how I mean the yogis had it right. I mean, long ago. It goes back 5,000 years ago. Taoism, all of that. If you know, having been exposed to that recently at that retreat in Costa Rica, it was like, okay, I could certainly fine tune things, but you know, I realized that my idea was not original, but I was able probably 30, maybe 40 years ago, you know, 3 kids, wife, mortgage, new practice, starting from scratch, practicing differently than other dentists in the area. I mean, there was a lot to be kind of, you know, wound up about. And I was working hard. So breathing practices, and then also sleep. I think really focusing on sleep. And I made a lot of mistakes there. I had the ability to stay up late at night and work through my second wind. And so I think breathing but really it's about, again, it goes back to mindfulness. But it's about just telling yourself that if you work hard and you know, if you can acknowledge that you're a good person, you're doing great stuff, that everything will work out. And that's a daily, I think that's a daily dialogue you have to have with yourself. So I think that's kind of how I do it. I mean, exercise certainly helps. I feel much better exercising. I feel much better going out down the hill and walking around the lake, seeing greenery, mountain biking, you know, whipping through the trees, skiing. Yesterday we skied up at Alpine Meadows. We're still skiing in May. You know, the skiing wasn't great because it was so soft, but I just took a hike to an out of bounds little area. It's called Idiot's Delight, up near Alpine Meadows near Tahoe. And it was just nice to be alone and to see the views. And even though the skiing wasn't good, it really enriches you. It just makes you feel great and positive. So just staying positive and making sure that you can scan the horizon, that neurological effect of being able to see the horizon and walking towards it. I think that really has a great effect. Listening to music is my way of meditation. I will throw on a record, sit in the barn. Lights are out. It's not dark, but the lights are out. There's no visual distraction, no reading, and just listen to one side of an album and just closing your eyes and imagining what that moment may have been like. You know, was it a recording studio? You know, why did the musicians arrive late? You know, were they drunk? I mean, I'm referring to a lot of stuff from the 50s, you know, heroin, you know, this is jazz, but you know, it could be a concert hall. Where was it recorded? And you just it's not just the music, it's really pulling away and leaving your body and your worries and then, you know, moving up to a different kind of, you know, thought patterns. And so I think it's really about managing stress and anxiety and being able to turn that off every day. You can't let it go for more than a few days. We're not good with constant stress and chronic stress. We're good for short little moments of stress. And then you got to recover and regain that positive attitude and keep going. That's the only way we're able to really function well.
Yeah, I couldn't agree more. I think nature and just, you don't even have to necessarily be in the sun, but like that, just getting the infrared, it just affects our cells and the
Totally.
mitochondria. I mean, it's so nourishing. And
Yep.
that's one of the biggest problems to me, is that we're just disconnected from real nature. And
Yep.
however it works, whether it's if you can get to the top of a mountain with snow on it, or if you
No.
can get out to a beach like where I am. I mean, you got to do it.
Yep.
It's so important.
Yeah.
And you were talking about what's leading me into my next question. That's stress. And being that we're both doctors, we can obviously understand how high paced things can get. Things can get stressful in the office, and that can kind of wreak havoc. And there's this term that somebody coined called burnout. And so how would you suggest people to prevent, or practitioners really, but people in general, to prevent burnout, and
Right.
for practitioners to kind of cultivate compassion for their patients, and
Yeah.
be able to balance that with their private life? I mean, it's delicate, but you have displayed that to one degree or another in your own life. So
Right. Well, you bring up a great point. Burnout is very high in dentistry. It's not as high as medicine. I think the medical world overtook us decades ago. But being a empath or a healthcare provider, I mean, one that cares and really puts their heart into it and their mind, that can be very draining. And stressful, and it's hard to see people suffer. I don't see it anymore, but I see it on Instagram, and people really are having a tough time, and with oral health, and that can take you down a little bit. I think it goes back to everything we talked about: mindfulness, dealing with your own stress. But I would recommend. So the advantages, I mean, there are a lot of disadvantages to being a dentist. One is burnout. The advantage of dentistry, at least for now, until you're working for someone like a private equity firm or a corporation, but if you're working for yourself, you have some control. So what I did early in my career is I worked 3 days a week. They were 10-hour days, though. So I worked Tuesday, Wednesday, Thursday, 10 hours a day. The average clinician in the US does between 28 and 32 hours. They don't do 40 hours. It's too much, although there are some that do that. And I would not recommend you do that. It's just too much. You're going to be spending some time when you go home working, and working on issues with the practice, managing the practice, or doing research, or keeping your license, continuing education. That takes time too. But so I worked about 30, 31 hours a week, but that gave me a 4-day weekend. It gave me time with my kids. If my wife was traveling for business, I was able to pick them up, drop them off. I would go to some of their school functions. I think as long as you can stay connected to some version of normalcy in terms of whatever that is for you, it may not involve children. It may involve just having a partner or being single and having a life where you would plan a 4-day trip. I have some friends that live alone, and between their work hours, they're out trekking and accomplishing something, or raising money for someone other than themselves. So if you can keep one foot firmly planted in that, and if you realize that work allows you to have that and a quality life, and then you're not going to separate the two. The two definitely mix. But what I see is most practitioners go in deep. They go in deep with the business, with dentistry, and they literally go overboard. And it finally catches up with them. And then their home life is a wreck, so they have nothing to fall back on. So I think it's really where you invest, not necessarily time, but effort. And so I think, stay fit. Exercise a lot. I would recommend exercising at least 3 times a week vigorously, where you're sweating and getting out. I'd recommend walking after dinner. I'd recommend working on sleep. Set an alarm to go to sleep, not to wake up. That was my big problem. I would stay up late at night because I could. I'd stay up till 1 or 2. So I'd work till about 10, and then I would listen to music till 2, and then go to sleep. But then the alarm would go off. My wife's alarm would go off. And I was at work. I was in someone's mouth at 7 a.m., on that 3-day work schedule. Later as I got older, I went to a very unique schedule. It was come in late on Monday, stay till 6. So 10 to 6 on Monday. Tuesday was early, get out at 2. Wednesday was a full day. And then Thursday, get in early and leave at 1. So I still had a 3-day weekend, 3.5. So take advantage of the fact that you're self-employed, take full control over all your stressors. I mean, you have to own it. I would say to most practitioners, you're the cause of your own stress. Now, in the corporate world, that's a different story, and that you can't own. So I would say it's a great profession because you do have control over that. And if the overhead is too high, then bring in a partner. I mean, you have control in making decisions, and so ultimately there should be no burnout. And if you're approaching burnout, you have to make some big changes.
Yeah, and I've been implementing, and that's what we basically do at the office, something very similar to what you're describing. And I love that you didn't say the word, but you're basically describing accountability on the practitioner's part.
Exactly.
You have to be accountable for,
right.
And I mean, this isn't just for doctors. This is anybody. I mean, you have to be accountable for the things going on in your life.
Right.
And and that's where we learn and grow and then find the lessons, right?
Yeah.
And I love that from what I got from that was that basically you have your practice and your business, and I mean, obviously that's a priority, but having something to aspire to or inspire you outside of practice is essential. And it really creates a much more fulfilling internal environment.
Yep. Yeah, I think you really have to take that role of CEO seriously as a dentist. And a lot of dentists just want to do the dentistry. So they hand that off to maybe a spouse at the front or an office manager or the staff. And that's fine. I'm not saying that's a bad thing, but you really have to take on that role as CEO because you are running a business and you are also the workforce. It's a very unusual job. It really is.
I am learning just that. It really it really is, because for years I've been in private practice I'm going on 13 years, and for the first 3/4 of that it was just getting to focus on dentistry. I did a lot of observations about how the business is run, but I didn't actually have to do anything. So yeah, it's it's a new beast, so to speak. And with one thing you started off with, which is kind of leading us into our next section here, which is really what you do now and what I do in practice, and I guess what you did in practice as well. And that's a big part of that is addressing the confusion, because there's this dichotomy in medicine in general, but especially in dentistry, there's just two seemingly, from an outsider's perspective, it could be like two completely different ways of doing things. Obviously, it's not completely different, but there are some very, very distinct differences. And that's kind of what I want to switch to now. But before we really get into some of those details, one of the mottos that I see you say and have on your websites and things like that is that you can't be healthy without a healthy mouth. And you've had your own health journey. And if you could just kind of talk about that a little bit and what that was like for you.
In terms of dental health, or?
Well, just your health in general.
Right. Yeah. So I pretty much, I mean, I've very blessed with good dental health. I mean, I had anterior crowding. The width of my maxilla is not ideal. Class 2 retrognathic, small airway, which I found out in my late 40s. But thank goodness I'm able to breathe through my nose. I mean, I can mouth tape at night. That's a biggie. And half of us, maybe more, cannot breathe through our nose, which is something so wonderful is taken away from you when you can't breathe through your nose on so many levels. So I'm very thankful for that. But it kind of, I mean, in dental school, and I'm not sure, I mean, you're a more recent graduate than I am, but I don't know. I mean, in my curriculum, and this is late 80s, at one of the best dental schools in the world, there was very little discussion of the linking between systemic and oral health. There was that whole thing about pre-medding for, bacterial endocarditis. That's about it. And I'm sure you still got that, although the prophylactic, the pre-meds regulations, not regulations, but protocols have changed on that.
And they do like every 6 months.
Exactly right. Yeah, you have to kind of stay tuned to the American Heart Association. So it took me, my journey of being a clinician, to figure that out, that, okay, so this patient always has cavities, but their saliva is very ropey and they complain of dry mouth. Then I realized that they can't breathe through their nose. Maybe they have rheumatoid arthritis, but they also have perio. I even saw some patients, some older patients that weren't great patients. They wouldn't come in often enough. They would only come in for emergency work, but they had perio for 30 years, and then they would get Alzheimer's within years of retiring at age 65, that kind of thing. I saw it with my mother. So you start making all these connections. I think that is the key to being a good clinician. Yes, you come out of school, you're trained to be a safe clinician, a safe beginner is what they used to call us. They give you the title doctor and you run with it, right? But to me, it's really what you learn. And as an observer, and again, that's what Ayurvedic medicine was. That's what all the ancient medicines were. They didn't have studies. They weren't even writing things down. That knowledge was observational, clinical observation. They typically got it right. Their sample size, I don't know what it was, but whatever their practices were, maybe they share information with other clinicians. And then that would get passed on through an apprenticeship to the next generation. And that body of knowledge got built over time. And we still have, we can still see it because it has been written down now. And most of it was correct, not all of it, but you could argue that they were more correct than we are in Western medicine. And we have the studies and we've got the microscopes and the scanning electron imagery and DNA analysis and all that. So I think as a clinician, you become, if you're a good learner and you have an open mind and you try and throw a wide net, then you start seeing these connections and then you start looking into the data. And most of us don't have any functional idea of how dentistry affects breast cancer, for example, or why people keep getting canker sores, if they're mouth breathing or if their oral microbiome is dysbiotic. And those things we just don't get that in dental school. So you really have to pick that up by hanging out with people that are a few years ahead of you, by reading the research, continuing education. There are some people that are forward thinking, that are kind of beyond the normal curriculum. You know of many of these organizations, the IAOMT and Forsyth. I'm working with Forsyth, part of the Harvard dental arm for research. They've been doing this longer than anyone else has. Since the early 1900s, they've been studying the oral microbiome. They didn't call it that back then, but so there are plenty and it's not a dental school. It's not a curriculum. It's a bunch of researchers that have access to an amazing amount of information. But how many dentists have heard of the Forsyth Institute? Not many. And so there's this big disconnect. Of course, we're disconnected from physicians and the whole systemic world. We practice in these two parallel universes. There should be a lot of crosstalk there. There isn't. That's changing, thank goodness. So really, if you're I would say the best feature in a clinician, other than clinical skills, is the ability to have an open mind and to be a great observer and to be able to categorize that, whether it's writing it down or putting it into a spreadsheet or just remembering it and then relating it to future encounters with other patients that have similar cases. That makes you a better practitioner. So that is the functional way of practicing. I think that's one aspect of it, is being a great observer of what you see in front of you. It's almost like clinicians are clinicians. I think that's more of a surgical fix the symptom kind of thing, approach that first, but then what do you do from there? I think then you become kind of an educator and a kind of a big thinker in terms of what is the big picture and what can I do? How does that relate to my patient? If they have joint issues and they have perio, let's aggressively treat the perio while the physician is trying to treat the rheumatoid arthritis. Maybe we can beat the physician to the punch and take care of the joint symptoms. So I don't know if I answered your question or not.
Well, no, in part, and we'll come back to that. But what you were just saying is, I completely agree with. For an example, documentation is extremely important. So you can just see how somebody is progressing one way or another over time. And
Right.
I think I'd say probably more than half of what I do is education,
Right.
and it's conversational. So I think that's extremely important. I totally agree with you. But through your observations of your practice, how did that tie into your own health issues? Because to my
Oh,
understanding, you
right.
had some things with sleep apnea or like
Right, right,
early
right.
on.
No, no. Thanks for bringing that up again. Um, so we're all kind of in denial in some parts of our lives, and I was very fit and thin. I had a low BMI. I was literally backcountry skiing and hiking, doing 5 to 6 thousand vertical feet a day, and then skiing and digging a hole at night, in the snow, and camping and doing that for 6 days. And this is the Trans Sierra route, and then backpacking, and I would play soccer and 3 to 5 sets of tennis, whatever. And I was tired, but I didn't know I had sleep apnea until we dropped off our oldest daughter at college, and that was the first time we had all been in the same hotel room for a while. And I mean, I literally woke up, true story, 3 of my daughters beating me with a pillow, going, "Dad, you were so noisy last night." I'm going, "Wow, okay." But even then, snoring was kind of, to me, I mean, and to most of the world and even practitioners, was like, okay, when you get old, you snore. But this was in my 40s. And it turns out both my wife and I were snoring. Both of us had sleep apnea. And so I think that really kind of that was a big part of this oral systemic connection. Where does that sleep apnea come from? Well, as I told you earlier, I have a small jaw, retrognathic, narrow maxilla, and that leads to a smaller airway. And then as you get older, the airway muscles tend to relax more and collapse more at night. And so that kind of caught up with me. Well, then if you don't sleep well, then you start getting other comorbidities, like you start gaining weight. You can't, your fat metabolism changes and your appetite increases out of proportion to what you're doing in life. And also you start getting a little edgy, and you start getting a little stressed out when things don't go well. And so you lash out, and you're just, your composure starts to slowly crack. And is that aging? No, that was sleep apnea. And so both my wife and I, and she's in healthcare as well, we went through the process. We had great healthcare, was near Stanford Hospital and connected to that. And it was so enlightening in the sense that it was a joke how medicine treated sleep apnea. And again, we were able to navigate it finally. And that's why I wrote the book, The 8 Hour Sleep Paradox. It was so difficult and tortuous, and there was so much pushback because the insurance companies don't like that PSG, the attended sleep study. It's a $3,000 or $4,000 event, and we were pretty healthy and thin. We didn't have any comorbidities like heart disease or anything like that. So there was a lot of pushback. So when we went through that whole process, and then later I realized this was that one of the root causes was facial development, lack of breastfeeding, maybe early diet, those kind of things, lack of minerals in our diet, and certainly with my wife as well, that this has to come out. I mean, this information, again, being observational and recording all this in your mind, this is information that I had to get out to my patients. And there are several other examples, but that was probably my biggest aha moment, realizing that I was having a good time doing well, but I was snoring. My airway was suffering. I was not sleeping well. I didn't have an Oura ring at the time, but I had 3 or 4 sleep studies, and it was pretty clear that deep sleep and REM, for that matter, was too short, and there were too many interruptions that were waking me up. And even having mild sleep apnea, that's 12 interruptions per hour, the physician literally told me that you shouldn't worry. I said, "Do I need a CPAP?" I didn't know much about mandibular advancement devices at the time. He says, "No, you're fine. Do you take naps?" I go, "Yeah, I do take naps. Do you feel okay? I mean, do you ever fall asleep while driving?" And I go, "No." And then my wife, she had severe sleep apnea. She had 35 interruptions per hour. And of course, they did a triple P surgery, and then CPAP. CPAP wasn't great. We did an oral appliance for her. But to make a very long story shorter, we both dropped our AHIs to 0. based on subsequent testing, attended sleep studies. And obviously for my wife, it was night and day in so many regards. But for someone that I really didn't feel like I was tired, it made a huge difference, a massive difference. And it even helped my oral health. I started mouth taping. I got fewer cavities. I wasn't reaching out for the carbs. I became fat adapted. I was able to give up sugar because the cravings weren't there. That whole leptin and ghrelin hormonal kind of axis was better off. I mean, I was satiated earlier, and I could literally give up sugar. I didn't crave it. In fact, I don't even like the taste of sugar anymore. But I would not have been able to do that if I hadn't addressed my sleep. And I don't get cavities anymore. My plaque scores are better. All of that. So it took me that turning point, that event of discovering I had sleep apnea to really wake up to how this is all connected. And from there, I kind of formalized it, wrote a book, started outlining it, got online. I wanted to broadcast this to everyone. And so that was when I first came online, literally. I mean, in so many different ways, right? Yeah, right.
Yeah. No, thank you for sharing that. So for just a couple, you were describing facial features, and what you were describing, I just want to explain to some people, it's basically like a narrowing of the face and then a jaw that's kind of pushed back. So
right.
that's
exactly.
kind of what so people can get a visual of what you're talking about.
Yeah,
and
absolutely.
In the book, it's funny, the story that you just expressed with your daughters, and I actually had that visual in my head that they're like standing over you, hitting you with pillows, and it was hilarious when I was reading the book. So thank you for sharing that. I'm sure there's a lot of people that can relate to those types of things that had no idea prior to. So what is functional or holistic dentistry, and what are really the main differences between this and the current conventional practice of dentistry?
That's a really good question. Difficult for most people, even practitioners, to really define, because I mean the end result is the same, or we think it should be the same. It isn't the same. The outcomes are better in functional dentistry, but it's like, God damn it, I'm a doctor. I'm going to heal someone. I'm just going to fix the problem and everything's fine. So what's this functional approach all about? Well, I always try and sum it up in one clear way before I start going down rabbit holes. So I would say it allows the practitioner to intervene in prodromal phases of disease. And what that means is that, and we have lots of tools now that allow us to do that. And we have curriculums now that teach us how to be that way. And again, we have to be open-minded, as I said earlier, cast the net wide. So what that means is that instead of, treating gum disease, and it's the same thing in the medical world. There's functional medicine. Everything I think about and have tried to do in functional dentistry is modeled after functional medicine. Why wait till you get high blood pressure? Why not, whether it's through DNA testing or a good medical health exam, family history, combination of both, obviously, diet, counseling, lifestyle counseling. Why not never have to deal with that ever in your life by addressing it before it actually happens? Same thing with gum disease. As you know, gum disease is very difficult. It is our most difficult thing to work with in patients. And most of us deal with it when we start seeing pockets and when we start seeing bleeding points and recession and again, now with oral microbiome testing, we know if someone is prone to getting gum disease or cavities, for that example. I'd rather never have to fix a cavity and speak to someone about how to prevent that cavity rather than filling the cavity, because there's no going back at that point. And then especially the people that come in every year, every 6 months, and they always have cavities. And most of us think that's normal. And it is normal in our world because we're eating crap. We're literally helping and augmenting the bacteria in our mouth in a distorted, dysbiotic way. We're actually promoting decay formation by eating what we eat. So it's a perfect storm. It's the same thing in medicine. And now we have a pill that makes us thin. So, the food company produces all these great, tasty foods. Some of them have ingredients in it that make us addicted, that actually addict us to it. through behavioral response, flavorizers, ingredients that really don't have anything to do with the food. Then we consume it. We seek it out. It replaces other healthy foods because we're eating more of that. It's not just that we eat that. It's that for example, the whole thing with industrial seed oils, that's replacing a lot of good fats that we would have eaten that would have lowered our blood pressure and prevented arteriosclerosis and hardening of the arteries. So that's a bad thing. It's displaced the good stuff. And then all of a sudden we're sick and we have high blood pressure, heart disease. We've gained weight, so we're more likely to have a smaller airway with adipose, with the tongue getting fatter and other parts of the airway. So again, I went down that rabbit hole. It's an enlightened practitioner that understands where all this begins. And we use the term in functional dentistry, as they do in functional medicine, practicing upstream. So before the patient jumps into that disease cycle, instead of waiting midstream or at the bottom of the stream and just dealing with the symptoms. Dealing with symptoms, we're pretty good at, but it comes with a lot of side effects of medications, surgeries. It's just not a great way to age. And the mortality risk is higher, and your quality of life certainly is not as good. So it's really about working on disease before it even presents itself. And that may seem like a little bit of a confusing thing for non-practitioners, but there is this prodromal phase of disease where symptoms are not apparent to the patient or even to the practitioner. And if we're waiting for those symptoms, you're doing a great disservice to the patient. Don't wait for them. Make sure you know where your patient's going before those symptoms occur or manifest.
For sure. And some of those manifestations can be, if you're looking for them, you might be able to find them before before the person's symptomatic. I mean, with oral microbiome testing, just seeing little changes in alveolar bone on x-rays, just looking for mild inflammation that's there when it wasn't there. There's these little things that you can look for. And it's so important. And people really appreciate it because, and this is the thing that I frequently say, it's that it's healthcare versus sick care.
Yep.
And that the system that we've kind of found ourselves in overall is a sick care system, unfortunately. And we're trying to pull ourselves out of that. And at least I try and give people an outlet for healthcare.
Right. A functional provider would look at their new patient. Hopefully they're in by 3 or 4 months, when they're 3 or 4 months old, even earlier. I tell moms to bring in their kids as soon as possible. And if you see that the child has a tongue tie or cannot breathe through their nose, it could be at age 1 or 2. You know where that child's going in terms of dental care, not to mention medical, systemic health issues, but they're going to get more cavities. Their gums are more likely to be inflamed. Their oral microbiome will literally morph into a dysbiotic state because they're mouth breathing, because the saliva pH is different with low saliva levels. And then, of course, their face develops differently, and that leads to sleep apnea later. So again, if you can recognize those things, and by the way, a dentist can recognize sleep apnea decades before a physician can. I just want to put that out there. We're really good at it. We have the training. They don't. And so we need to work together with them. But anyway, so those are the things that if we catch early, knowing that those are the downstream ramifications of not catching it or dealing with it then, expansion of the arch, intervening with tonsils, adenoids, the inability to breathe through their nose, all those things. Why wait? The old way was to, your kid will outgrow it. If they don't, we'll deal with it then. Well, by that time, their lower face is developed by age 9. Most of the 80-90% of development is done. How do you reverse that? We have ways, but it's pretty traumatic. And it doesn't always work. And it would be better to intervene earlier and not have to do it that way. And then, of course, we have the orthodontists that come in. They're the big heroes, right? And they straighten the teeth. But they haven't fixed the root cause of anything. That's such a racket. Sorry.
No,
conventional orthodontics.
Yeah, I hear you. And you kind of touched on a point that I was going to make, is that I'm the only one in the office that sees kids, and
lucky guy.
It's I don't know. I find it fun, but I don't want to only see kids, but it is fun to see kids. But one of the and you would know this better than me because I'm not a parent just yet, but when the kids are getting around that like 10 years old-ish, maybe even a little bit before that, it's hard to break them of habits.
Yes.
And if they're not breathing through their nose, if they like certain foods, don't like certain foods, if they like to brush their teeth or don't like to brush their teeth, it is really hard to get kids. And parents are, I mean, it's stressful. So it's hard to help. So I find myself trying to support them to create those kind of changes. But like you said, the earlier you start with these types of things, just to get a child used to being connected psychologically with their mouth and other people, it's really, really beneficial.
Right. And starting earlier, for many reasons with kids, they're more amenable to change. But if they're a 6-year-old and they've got their habits, and it's that's hard to undo. And you're not going to take goldfish crackers away from them at age 6. That's just like, it's not going to happen, right? I think, I mean, I was giving you a hard time because kids are hard to work with sometimes, but they're lucky to have you because you are thinking functionally, and so you're intervening early, and that not all dentists do that.
I'm doing the best I can.
Yeah, I mean, they're just filling cavities. And then mom or dad is like, another cavity, another 10 cavities in one visit. It's like, what's going on? It's like brush and floss. You're not brushing and flossing your kid's teeth enough. I mean, it's like, no. There's so much more to it than that.
Yeah, and you literally, that was a perfect segue to, so of course, as dentists, and all dentists that I know anyways are recommending brushing and flossing. I just see this as the tip of the iceberg.
Yep.
So like the tip of the iceberg.
Right.
And
right.
What are the primary factors people should be aware of and integrate, which is the most important part of it, with regard to proper oral health practices?
Right. Well, I mean, that analogy is great. Tip of the iceberg. It's not the big iceberg that we see, above water. And again, that's only 10% of the actual iceberg. The rest of it is 90% is below. And we're just talking about the very tip of the iceberg. And when you start thinking that way and start telling patients that that's the root cause of everything goes bad at that point, because the symptoms continue and the patterns of disease continue, and they get worse over time, actually. And then frustration sets in. And then the behavioral response is not so good. They're like, just F this, right? I'm just giving up, or I'll just pay the dental bill, and then everyone gets used to it. And they really, most of us, I think still today, think that cavities are a normal thing. It's the number one disease in the world. We take it for granted, and it's like it's normal. It's not normal. It's a recent phenomena, and patients love to joke about, well, what are you guys complaining about? It's keeping you in business. And I always reply the same way. We got plenty to worry about. Gum disease. And other things, right? And doing 10 fillings on a kid and having to knock them out, that's not fun for us.
No,
we don't like doing that.
It's my least favorite thing.
Exactly. So anyway, what was the question again?
Really, so the primary factors that people should be aware of and integrate, besides the brushing and the flossing.
Yeah. Okay. Well, okay. So I'll give you my short version, and we'll see if you want to continue from there. But to me, brushing and flossing, which I call biofilm management, is number 3. There are 4 things on this list. Number 1 is mouth breathing, and that shocks a lot of people. And it's like, well, okay, not most of us don't mouth breathe. So how is that a number 1 cause? Actually, 50-60% of us mouth breathe, and we sleep with our mouth open all night long. And that creates a pH change because there's no saliva. The oral microbiome changes. The bad bugs outnumber the good bugs. That whole modulation, the neighbors modulating each other and keeping everything in check and healthy. I mean, the oral microbiome does things. It's an immune response. It helps remineralize teeth. It's like a system. It's almost like an organ, like a ghost organ that is actually doing stuff in our mouth, and preventing disease from occurring in this very vulnerable part of our body. It's open. I mean, it can experience huge pH changes just by going out and running for an hour and breathing through your mouth. That dries out your mouth. The biome is impacted by that. Can it recover? Yes. Can it be reset? Yes. Can it get very, very sick and need to be reset aggressively with strong disinfectants? Yes, in some cases. So there are some people. So for people that mouth breathe, which is the majority of us, that's the number 1 cause. Address that. If you can't mouth tape, you can't breathe through your nose, then obviously you have to fix that, because you're going to have dental anxiety. beyond just having cavities and a lot of crowns and root canals and then missing teeth because they crack. You could be grinding more even because of that. Your dental bills are going to be high, but you're also going to be very phobic because when the dentist works on you, they're working on your primary airway. In other words, that's where you're getting your air. So they put a rubber dam on, there's water or saliva building up in the back of your throat. That's essentially waterboarding in a way. I mean, and you can't breathe through your nose and you're tilted backwards. So all of my phobic patients, 99% of them, there are other reasons you could have bad experiences early on in your dental career. They had issues. I mean, that was easy for us. Once we identify that, I would come out and say, listen, you're going to be very nervous seeing me if they haven't already expressed that. And they're like, yeah, you're right. I'm sweating it out right now. And it's like, well, this is why. And that was very helpful to them. Don't put those patients down. I would do stand-up dentistry on them. That was hard on me, but it didn't happen too often. Give them a lot of rest. I would recommend that all dentists have cuspidors. I think a dental chair without a cuspidor is tough on patients. And then rubber dams are difficult, but then we have all these new methods of suction and the little barriers and all of that works very well. So you got to keep that airway open, but you also can't block it. Visually, that's enough to set them off.
Mm-hmm.
But if you're not if you're able to nasal breathe, then the number one cause is probably diet. So diet and mouth breathing are kind of toggling back and forth, but mouth breathing, close second would be diet. Our diet today is horrendous. As we spoke earlier in this episode, we talked about how it's actually accelerating and increasing the potential for decay. We're actually making it optimal for decay, for inflammation in the mouth, necrosis of gum tissue, sensitive teeth, bad breath, certainly halitosis, and even canker sores. We're accelerating that process by the foods that we eat. And then number 3 is brushing and flossing. Now, we've been talking about this for 10, 15 minutes. What dentist has time to talk about this? The hygienists have time.
Yeah.
They have a person sitting there for an hour. This is what should be mentioned. And then the 4th reason would be genetics. Yes, some teeth are more, as the developmental groove is invaginated, there's, there are genetic reasons for some people getting more prone to getting cavities than others. And then there's some epigenetic factors as well, which points back to mouth breathing, the environment, air pollution, allergies, and all that. So it's a very complicated thing, right? I mean, it's multifactorial. Everything in the body, whether it's good or bad, is typically multifactorial. There isn't one reason. So I think as a profession, we have to stop leaning on this brushing and flossing and come see us twice a year. Yeah. That's not enough information for our patients.
For sure.
We're doing them a disservice.
Definitely. And that's the term I use, is it's all multifactorial. And that's really why I like the term holistic, because it's the whole system. And everything's playing off of one another. And just because you're in one state today doesn't mean that's how you're going to be tomorrow. Right. And just getting like blood work, it's tricky because you're just getting a snapshot in time.
Right.
But that's why doing these things at regular intervals and seeing fluctuations and changes, and obviously how you feel, makes a big difference.
Yeah.
And we've normalized, like you're saying, these certain kinds of conditions, whether it's sleep apnea and snoring or cavities. I mean, these things just aren't normal.
Yeah. And we start believing the message that we're giving our patients. So if we keep saying that over and over, it's not brushing and flossing well enough, then we become part of that cycle and we believe it to be the only factor. And that is extremely dangerous, because then our treatment modalities and our measure of success and our ability to really work in the prodromal phase, if we always fall back on the fact that you just didn't do a good job, that's so bad on so many different levels.
And that's traumatic for people too. I mean, I would say at least half of people have some sort of dental phobia. And now if you're criticizing them and then putting them down, essentially telling them that they're not doing a good job.
Oh, makes it worse.
You're lucky if that person comes back in for the next cleaning.
Right. Yeah. And only 50% of patients in the US see us on a regular basis. They'll come in if they're in a lot of pain. But isn't it interesting that it's about 50% in terms of phobia? It's about 50% in terms of mouth breathing. And it's about 50% that don't come and see us on a regular basis. I mean, those numbers align in a way, and the shaming has got to stop. I mean, that's something we talk a lot about at Ask the Dentist, and it makes things worse. And it's not. It's again believing our own message. We have fallen back on our own message, and so we actually believe that it's the patient's fault. It's really not the patient's fault. It's multifactorial. There are a lot of things going on, and if we can just point those things out, they may not always like the message. Stop eating this food. I'll just brush and floss more. Well, that won't work. I mean, it may mitigate it a little bit, but you're still going to get cavities. You're still going to alter the oral microbiome, and you're going to elevate S. mutan bug levels and P. gingivalis bug levels. You are altering this incredible ecosystem that is part of our existence and part of our body. Yeah, we're not just humans. We're a superorganism.
Yeah,
very complex superorganism, and we're not taking care of that part of us, that foreign DNA. Actually, it's alien DNA to us. We're not taking care of it, and if we don't take care of them, they can't take care of us, and then the relationship breaks down, and we start getting really sick. Yeah, and that's the gut microbiome. It's all the biomes.
Yep, and it's really about having a partnership, creating a healthcare partnership, and that's what it, in my view, should be between practitioner and patients.
Yep.